Okay, Betty, before we begin, you check your glucose, blood sugar's fine, and you're eating something. Excellent. Okay, Betty, so we're all warmed up. We're going to start off the program, we're going to do the box push-ups. Now, you've got this little bench. It should be a correct height, and if we need to adjust it, we can go lower or higher with the incline. This is a little bit easier than doing a straight push-up. It's important, this will be working your anterior deltoids, front shoulder. It'll be working your triceps, the push, and also your pectoralis major. So we're going to do 2 sets. We're going to do 10 to 15 reps. We'll try to go for the 15. We'll see the difficulty level and then we can work up. Okay, it's really important. You've got the core braced. We want to prevent lordosis, which is curling over. You want your hands just past shoulder width. Now we don't want our elbows going straight in. That puts a lot of pressure on the tricep. Okay. What we want to do, and we don't want too wide, because that will put pressure on our wrist and also works our chest to a bit too more than we want to. So braced, shoulders back and down. Move at chest level, you can move down lower. Now, try to avoid looking up, looking straight down, head neutral. Make sure you're keeping tension in your chest. Once again, pulling back into your scapula. So you get a full rep. Okay, let's go. Okay, now you want to be straight. So can you keep your head looking straight ahead, look down. Brace your core, your tummy tight. Now you're bending a bit at the hips, so maybe to do that, to straighten that up, if you lower your legs a bit, bring your feet back. Now, is that too difficult, or do you think you need to go a bit higher? Now we're just bending a bit of the hip. You want to straighten, that's the way. Now you might find it a bit easier if you're moving arms more towards 45 degrees, coming down this way. Just watch that back arching. You're moving as a plank, so your body and all the way down. I think it's a bit low. Okay, so there seems to be a bit of strength. So next time what we'll do, we'll raise the height, find a higher box. Okay, stop that there, we'll move on to the next exercise. Well done. Did you feel that in your triceps?
Yeah.
Okay, Betty, so we're going to start off with the seated row, the TerraBand, or the resistance band. So I want you to start off feet in slight flexion, okay, back nice and straight, chest up, and your palms neutral, so facing in. And what we're aiming to do is pull our elbows past our body. Now you want to guide it back and forth. Go back past the body, chest up, hold it, and back, and that's 1 rep. Okay. Try not to pull your body too far forward. You want to keep your shoulders back and down, back, down. Okay, let's get you down here. We're going to do 10 to 15 reps. This way. Flexion, get all your fingers in there. Away. Back straight, pin your scapula in, yes. Put back. That's excellent. Very good. I'm counting. 4, 5, 6, 7, 8, 9, 10. Really squeeze into your back there, excellent. 12, 13, 14, 15. Okay, Betty, now we're going to move on to chair squats. So we've got that chair for safety, just to get stronger, and we'll move to going deeper as you progress. The chair squats are going to work your gluteus maximus, your hamstrings, your quadriceps and calves here. go through in them ears. It's important to keep our shoulders forward, shoulders back, chest forward, shoulders back and down. Brace your core again. Now backside out. We're going to keep our body upright, feet shoulder width apart. You can raise your hands. That helps to keep your body upright. Now imagine you're sitting down backwards, driving down into the heels. And you don't want to go and sit all the way down the chair. You really just want to touch it. Okay. And once again, 10 to 15. Your knees are tracking your toes, so I don't want to see you going forward over your toes. Should be coming down the same spot. Okay, we'll move on to the next exercise. We're going to do as I just demonstrated. So I just demonstrated the chair squats. I'd like to do that. We don't want to sit down in the chair. You just want your butt to touch it. You're using it as a guide. Okay, so remember what I just showed you. Your feet shoulder width apart. Move forward a little bit. Okay, remember, you want your backside to finish at the front of the chair, so move forward a bit more. And you don't want your knees going over your toes, so no more over your toes, and just like I showed you. This is the last exercise in our circuit. We're going to do 2 sets of this, 10 to 15, and we'll do crunches. Works our rectus abdominis and our obliques, external and internal. On our back, we want our back rounded, hands across the chest. Our feet at 45 degrees. Now it's important not to just pull up, you want to engage your core, flatten your back down and pull up and hold. Now we're not trying to go all the way to the knees, but think ribs to hips. Don't reach with your neck. Keep that tension on the way up and down. Exhaling on the contraction. If you feel any lower back pain, then stop. You can always modify. We could raise your feet. Now, of course, we don't want you holding anything isometrically. We don't want to increase your blood pressure. I just want you doing straight reps. Keep that movement. We're not going to do a hold at the top. Okay, let's go. Get that positioning right. Pull yourself down. Okay, hands across your chest. Position your back on the floor. Pull our feet in a little bit more. Okay, now feel the tension in your core. Think ribs to hips. We're just moving up, not pulling from there. That's brilliant. And back down. Now I want you to keep moving. We're not resting after each one. Really feel that. Ribs to hips. This away. Well done, sir. Visualize those ribs coming into your hips. Not arching our back. Pushing our lower back into the ground. Good. What are we up to? 11. How you feeling? Do 2 more, you can do it. 15. Okay, let's stop there. That's well done. Okay, 120-second break. Try one more time. You're doing really well. It's good form. Make sure that core is engaged.